Thank you very much for having me come down here and speak. I will incorporate the whole idea of academic and public health partnerships. And what I'll try to emphasize to you is where we need your help, okay? And so that'll be the lens. So as some people ask me, what is a health officer? So every county in California has a physician health officer. And you can think of us as sort of having two different hats for the county jurisdiction. Is that you can think of us as like the local CDC director and the Surgeon General for a specific county. So we're the ones that implement legal authority around health issues. For those that want a copy of my slides, if you go to my LinkedIn page, I did post them there, so you'll be able to download them if you want to take a look at that. And let's see if this works. Okay, so what I'm going to do really briefly, I'm going to give you a little quick tour of how I see population health from a public health official's perspective. I will incorporate a little bit of the data issues. I do teach a course in R at Berkeley. It's one of these things that I picked up, and I started teaching R back in the early 2000s, and I was trying to get people interested in this programming language. It took me a few years to get people interested in it, but I will incorporate a little because it has shaped some of my thinking about data. Our job is really about transforming complex systems. That is really our job, okay? At the end of the day, it's about protecting and promoting health in communities. It's about transforming communities. And one of the things that I will emphasize is that we cannot transform communities if we cannot transform ourselves. It has to. If you can't get your team to be transformed around issues, there's no way that we're going to transform communities. And then we're going to tackle. I'm going to suggest an area that we can all collaborate on that, for me, is one of the missing links in dealing with health inequities. And I already see that Stanford is already doing important work in that area. So here's where I want to start with, okay? One of the first jobs I did when I was hired by the health department in 1996 was starting to look at data across San Francisco neighborhoods. What you see here on the slides is on the left-hand side, you see causes of premature deaths for men in San Francisco, leading causes of death. Don't worry about the metric, they are age adjusted, but what you'll see, those red dots are African Americans, okay? African Americans. This data has been like this for decades. Our job is to close that gap. That's what we need to do. That should be our primary focus. On the right-hand side is women, okay? There's two key things to realize is these huge health disparities, number one. Number two, there's also a paradox there. Because if you look at the Latino population, you will see that the Latino population are among the healthiest. So if you think about Latinos that have disadvantages in terms of income, language barrier, immigration barrier, cultural barrier, all those barriers across the Southwest, on average, Latinos, except for the issue of diabetes and obesity, are healthier than almost every other subgroup, okay? So this is also part of it's to sort of understand why is that the case? What is going there? How can we bring that to the other areas? What I'm going to do also is, I'm just going to give you sort of a few key definitions of, so you understand my bias. So the definition of health that I'm using is just the definition of health from WHO. The definition of public health is the definition that I'm using from the IOM from the 1988 book on the future of public health. It is what we as a society do collectively to ensure the conditions in which people can be healthy. Now, the definition of population health, this is the definition that I like. And actually, giving this talk gave me an opportunity to actually tweak my definition. So a systems framework for studying and improving the health of populations through collective action and learning. And what I mean by systems, I'm really talking about complex adaptive systems. That's the framework that we have to start with, is realizing that what we're trying to transform are complex adaptive systems. Studying and improving is pretty self-explanatory. And then collective action and learning, I will get into a little bit. When I say health, I really mean all these dimensions of health. I'm not going to go over this slide. This is from SAMHSA, that talks about these different dimensions of health. And I believe in these multiple dimensions so much. I have 3 kids. All my kids have a copy of this. And I tell them, your job is to be a good person and to be well-rounded. And when they say, what does well-rounded mean? That's well-rounded. And I'm serious. And so one of my sons, he runs cross-country and he runs the mile and 2-mile on track. And so he pushes himself really, really hard. And I remind him, if you overdo on one of the dimensions, one of your dimensions, one of the other dimensions is going to be suffering, right? There's an opportunity cost when you become too focused on one thing. So it's a reminder of really a very holistic approach. And this applies to all of us. It applies to our employees, every single one of us. So what's true for the community is also true for us here. The other definition I'm gonna mention really briefly is a definition that I get excited about. So I teach a course in R at Berkeley, and I was gonna quit teaching that course. Part of the reason I teach that course is actually for relaxation, believe it or not. It's great just to go there and kind of just show people how to code. No politics, no conflict, no egos, and I have a knack for it. And I ask the students to do any kind of project they want, anything, and it doesn't matter where it's from. And in my class, I've had mathematicians, demographers, just really diverse groups of people. And the students started coming up with the most innovative projects. I was just blown away by the things the projects that they were doing. One student, for example, has a package for scraping web pages. He's in environmental health. He was scraping web pages around the world where people post the toxicants they get exposed to because the government doesn't allow that information to be available publicly. So people would figure out how to get these information on the web. He would scrape, and he was doing this global research on exposures to toxicants around the world. And I realized, oh my God, this field is exploding. We got to figure out how to use this for public health. It is very powerful. We got to figure out how to take advantage of this. So data science is the art and science of transforming data into actionable knowledge. The key word here is actionable knowledge. That has to be our focus, okay? Like when I see all this stuff on big data, to me, those are a lot of technical stuff. We're going to do the technical stuff. At the end of the day is how do we influence decision makers, whether it's a mother in the community or it's a policy maker at City Hall that we want to influence with actionable knowledge. And to the fact it becomes faster, better, more user-centered, we're going to be more successful. And so, I believe that there's a field of population health data science. It's the art and science of transforming health-relevant data into actionable knowledge. We have to influence decision-making. So here is my conceptualization of population health data science. And you guys can tweak it any way that you find useful, okay? First of all, I want to start from the top. Describe, discover, predict, advise, okay? Describe, so for example, I'm an epidemiologist, okay? Okay, we're really good at describing stuff. Discovery, epidemiologists are really good at doing etiologic hypothesis testing. And you can throw in some other areas under discovery. And I would say, for example, in public health, we spend a lot of time in the description area. In academics, there's a lot of focus on the discovery area. So that's knowledge discovery. I'm in the business of knowledge deployment, okay? We depend on universities to do discovery. On the front lines, we're deploying knowledge. And actually, that's where we need the help. Where do I really need help? Yeah, the predictive analytics is really important. I think where I need the most help is really in the prescriptive analytics, helping us make optimal choices for decisions that impact complex systems in the setting of uncertainty. That's the big challenge that we have. And to the extent that we're able to harness this data to help us make those decisions closer to real time, we're going to be more effective. I'm going to give you the trivial example, okay, of user-centered actionable knowledge. How many of you used Google Maps in the past week? Okay, imagine you turn on that Google map and you see that red or yellow thing and you realize there's a traffic jam, and then the Google map says to you, would you want me to recalculate a fastest route? And you say yes, and you recalculate. Think about that. That is actionable knowledge. Think of all that data is coming to you in a very customized way, helping you make the best decision in real time. That's good for you. It's good for your mental health. You're less stressed out. It's good for the environment. You're not burning a bunch of gas. And so if you think about it, it's optimizing the whole. It's simultaneously optimizing traffic flow and helping you as an individual make a decision. So the way that I think of population health data science, the areas that I'm specifically interested in is epidemiology, the decision sciences, health economics, and behavioral economics. That those fields are really critical. I really need to understand how people make decisions in the real world. How do I nudge people to make better decisions? How do I help help support that context for better decision making? And you can put in more things there as well. But that's the way that I think of. That's the way that I think of things. The thing that I really want you to take away from here is that is this one right here. This is where I need the most help. This is useful too. There's some interesting stuff happening here. This is where I need the most help. And I would argue that all of us need help. How do we make decisions about complex systems in real time in the setting of uncertainty? That's a lot of the things that we face in public health. Okay, so let me just really quickly, I'm going to define what a complex system is, okay? A population of diverse agents, all of which are connected with behaviors and actions that are interdependent and that exhibit adaptation and learning. Your team is a complex system. Your organization is a complex system. The communities that we're trying to transform are complex systems. And unless we really focus on the transformation of complex systems, we're going to run into a barrier. We're never going to deal with those health disparities, okay? We're not going to deal with them sufficiently. So why do we care? Because systems are ambiguous, deceptive, and unpredictable. They're difficult to control and direct. And we know this when you try to implement something and there's adaptation and resistance. They can self-organize and locally optimize into silos and tribes. Do you have silos at Stanford? Yeah. Can evolve along divergent pathways. So these silos evolve along divergent pathways that it's hard to bring them together later on. Can produce tipping points or epidemics and can produce emergent phenomenon. An example in the population of emergent phenomenon is herd immunity. So us figuring out how do we study and work in a very holistic way with complex systems is really part of our challenge. I'm going to give you just a few key tools that I find useful. What research question you ask, how you design your study depends on how you conceptualize a system. There's many different ways of conceptualizing a system. There was a recent article that came out that had a whole table of ways of conceptualizing the system. It starts getting complex. I'm going to just mention two really quickly. One is just causal loop diagrams, okay? I'm not going to go into agent-based modeling, but I do want to make a comment on social network analysis. I'll tell you why I'm excited about the social network approach. So I was invited to be on an IOM committee for studying how do we do study design around the children's immunization schedule. It is so complex. We have more and more vaccines. Parents are pissed off. There's a lot of resistance, and so they're trying to figure out what do we do. So, and you know, I was thinking, I'm just a public health practitioner. So I was sitting around with all these very powerful people with a lot of academic knowledge. And basically, when I sat around, here's just a simple example. Incidence of herd immunity inducing infection. If that increases, then community immunity, which is also herd immunity. If infection and immunity increases, herd immunity increases, so they both go up. That's a positive relationship. And then there's a negative feedback loop. So just using this, I sat there at the meeting and I listened to everybody. I just listened to everybody talk, and I just kept thinking about, okay, what are the key things working here? And this is what I came up with, okay? And you'll see here is that what I was trying to do was really understand this as a system. Everybody was looking at part of the elephant. I was trying to understand it as a system. In the middle there are a demand for vaccines and all the positive and negative inputs that increase the demand for vaccines. Then right below that is the number of vaccinations. And then as you move over, you'll see I can't even read it. It says demand for reduced alternative schedules, number of vaccine and adverse events, and then the complexity of the immunization schedule. This was just a mind exercise, just listening to everybody and constructing this system. When you look at this, you realize that the complexity of vaccination schedules is only going to increase, adverse events are only going to increase, parental concern and resistance is only going to increase. Okay? There is no study design that's going to solve this. Okay? They're looking for this magic bullet, but when you look at it in a very holistic way, it makes you realize that that's not the case. So it forces you to really reconceptualize on how you're going to study this issue, because the issue is not going to go away. As long as we continue to have more vaccines, we're going to have more vaccine adverse events, and we're going to have parents who are concerned about that. And they're going to associate it with whatever whatever issue happens with their children. So the other one I want to just briefly mention is social network analysis. And so I was fortunate enough to be invited to go and study intensely for 1 week at University of Washington with Dr. Martina Morris. She's a sociologist, but they've developed a package using R that's freely available. The URL is there, that will allow you to model social relationships. It is phenomenal what they've spent many years developing this package, and now they've made it available. And what they've done, I have a background in infectious diseases. For those of you who know a little bit about modeling infectious diseases, it can be it's really hard once you get beyond a few parameters, a few covariates. It's really hard to model. What they've done is that they've developed the ability to actually model relationships. So rather than focusing on the nodes, it's really about the connections. It's really about both. It's about the nodes and the relationships. And you can develop models. I think you have to have a laboratory, because you can have really simple models with just a few simple rules that have incredibly complex phenomenon. And what we see in the real world is much more complex than just a few simple rules. It makes you humble to realize that what we were observing is a slice in time, one realization of reality that in fact is much more complex than we ever imagined. Going from left to right, this is looking at HIV transmission, where you have your regular partnership and then you have concurrent partnerships. By just increasing concurrent partnerships, you can see how that drives that epidemic. Okay, so it's the relationships that matter. For me, it's giving me a different paradigm for how to think about a complex system, not just the nodes, but the relationships, what they call edges. And of course, they work with R. So all this stuff is open source. It's freely available. And they're training people around the world. If you ever get a chance to go up there and spend a week with them, it's fantastic. And so they would really look forward to more collaborations with folks. So when I was there was over 50 people from all over the world that were getting trained on doing this. So now what I'm going to show you, so I've been talking about complex systems. So now I'm going to give you a few key approaches that we do in public health with the community on trying to influence the transformation of complex systems. I'm an epidemiologist, so you have to forgive me. I think in terms of cause and effect. The cause here can be a natural cause, but it could also be our intervention. We can be intervening to try to impact. So here's the first one that I'm sure all of you have heard about, a health impact assessment. Is looking at the health impacts of non-health programs, policies, or proposals. They're going to build a freeway here. What are going to be the health impacts of that freeway? Okay? There's going to be noise, pollution, pedestrian injury. It's going to affect how people use open spaces. When you do a health impact assessment, you have to take a systems framework. You have to bring people around the table who understand the system and its complexity and try to really figure out what are going to be the adverse impacts. So a health impact assessment, this promoted by IOM, this is one of the tools that we use in public health. You have to take a systems approach, so you have to think in terms of systems. To the extent that we're better at doing that, we're going to be able to do better health impacts assessments, okay? The next one I'm going to show you is collective impact. Collective impact is now the reverse of health impact assessments. You're trying to focus on a specific health outcome that's usually very complex because it's part of a complex social system. And you bring people together around mutually reinforcing activities. An example here is the population health center here that you have. You're trying to mobilize all these diverse entities, and you're trying to get that coordination, these mutually reinforcing activities, to ultimately have collective impact. Together, you're going to be able to achieve and transform and achieve your big goal by coming together. Rather than having isolated impact, by working together, you have collective impact. So this approach right now is transforming how work is being done around the world. And this specific approach was popularized by people from sfg.org who published their paper in the Stanford Innovation Review in 2011. And so the Stanford Innovation Review has now published several papers really talking about collective impact. But when you read their papers, you'll realize what they're talking about is how do we transform complex systems? And you not only are looking to transform complex systems to reach a goal, but the people that you bring together are themselves transformed. Okay? How you work as a collective, you become transformed. So, for example, if you just look here at common agenda, shared measurement, mutually reinforcing activities, continuous continuation and improvement, and backbone organization. If you reflect for a moment and you look at this for a moment, you will realize that this is just quality improvement applied on a social scale. This is continuous quality improvement. Do people understand what I'm saying? How many, if you're in a clinical setting, then you understand what I mean by QI, right? You have a common goal. You're doing measurements. You're bringing people around the table. You're bringing people around the table. How do we improve this for patients? Continuous improvement, and then you have infrastructure to support that. It is continuous quality improvement at a social scale. This is actually really powerful for me because I realize that all those QI tools that you're using in your clinical setting can actually be applied helping communities to transform their communities through something like collective impact. You're bringing people together and you're helping them to collectively improve. A really important part of this is the backbone organization. One of the things that we realize is that when you're bringing people to come together and they're bringing to the table the things that they are already inspired to do, it takes a huge amount of work to do all that alignment and coordination. It's a huge amount of work. We all underestimate how much work it is. And we now have funders from philanthropy who realize that that's the case. And so we're now beginning to get funding for backbone support. It's so critical to the success. So another way of thinking about this is a little simple. One of the things I realized in observing collective impact projects is that people really have a hard time thinking of a very complex system. So I try to get it down to 6 points, and I actually just stole the ideas from other folks, and I give the attributions at the bottom. The first here is people. When I talk about people, I'm really talking about mental models, belief systems, and culture, what people call the isms, okay? This always exists, always, whether it's in a community or a university. We have mental models for how things are supposed to be. If you do not transform mental models, you're going to run into a big barrier. I'm going to give you a concrete example, okay? 10 years ago, who would have predicted that we would have marriage equality today? None of us would have raised our hands. But what happened? Transformation of mental models. Once you were able to transform the cultural thinking around marriage equality, all the policy changes followed, and they followed much faster. This is an example of what you'd call a tipping point. It happened much faster than we ever could have imagined. It was 2004 that Gavin Newsom married a same-sex couple on the steps of City Hall. Who would have imagined that more than 10 years later we'd come as far? Who would imagine that we would have had an African-American president? Mental models are really critical. Policy, people know about policy, legislative and organizational place, program, providers, and patrons. So this is sort of an easy way of thinking about a complex system. So you can be saying, okay, we're going to try to transform people's mental models, but I'm going to be mobilizing all these entities. These things are always connected, and they're always true in every place and time. Whether you're talking about a unit or whether you're talking about a city, all of these exist simultaneously. It's always true. And I think one of the ways that I think about it at public health is that the way that we train to try to work with communities is that we train on ourselves. We try to influence our own systems. Okay. And then the last one is community-based participatory research. And that is, in community-based participatory research, you're letting the community define what the problem is, the approach, and the activities that they're the strategies and the activities that they're going to take, okay? And so in San Francisco, we have what we call the community action model, where we actually mobilize youth around policy issues. The youth define the issues. And I'll give you a concrete example of one. In San Francisco, we passed just recently a tobacco density ordinance. Every supervisorial district over time is eventually going to go down to no more than 45 tobacco permits in a supervisorial district. Okay, right now, there's a huge disparity. The high-income areas don't have a lot of permits. The low-income areas have tons of permits over time. How long did it take to do that? It took them 6 years to do that. And the tipping point was when they were able to develop a relationship with the Arabs Grocer Association. That was the tipping point. But there's an example where the community defined the problem. We worked with them. They learned how to do advocating for legislation, collecting the research, everything. So there's an example where it took them 6 years, but it's going to have a profound impact in San Francisco. And 6 years of students that went through that training are themselves transformed because they are the future leaders in public health and academia. So this is just a quick summary of 3 core approaches that we use in public health. I actually feel that this is really the future of the way that we do public health. Remember, at the end of the day, it's about transforming communities, and these are 3 key approaches that we use. So now I'm going to wrap up and just I want to get back to the initial issue, and that is, what are we going to do about closing that gap? Okay? What are we going to do as a university, as a member of the community, as a member of the Bay Area community, as a member of the intellectual capital that we have here in the Bay Area. And so let's think about that for a second. Okay. Newborns, okay, and then 6 months and 2 years, 700 new neural connections per second. And I know you have an initiative that's called the First 1,000 Days, and I'm going to come back to that in a second. How many of you here have raised children? Okay. How many of you are raising children? Okay. How many of you were children? We all benefited. Something happened to us. You're here at a premier institution. You guys are a selection bias. You guys probably have a lot of those neural connections. Okay. You probably have a lot of those neural connections. And there's a lot of people in the world that do not have those connections because early in life, they're exposed to what the Harvard researchers call toxic stress, which can be trauma from not just abuse, but also trauma from neglect. And I'm not going to go into that because you have a whole center here that's focusing on the first 2 years of life. It is critically important. It's really critically important. I'll tell you a little bit. If you just look here, so most of what they call brain neuroplasticity, most of the connections happen early on in life. Okay, between 0 to 5. If you're neglected, if you're abused, if you come from a dysfunctional household, you're less likely to have those neural connections, which influences your memory, your mental flexibility, and self-control, what they call executive function. You're unable to make good judgment. So if you leave this era, my wife's the first grade teacher in the first grade, by the way, and she sees these kids who come in first grade, and they quickly fall behind. So if you come out of this not optimized, what happens here? You're more likely to take high-risk behaviors, to experiment with drugs, alcohol, at the very time that you actually need your brain cells to get through high school and to get you ready for the next stage in life. This trauma early on affects not just your brain, your body, but also your behavior. How much time do I have? I better wrap up. Okay, let me go really quickly. When you download my slides, this is very simple. Adverse childhood events, experiences at the bottom, basically chronic disease and health inequities at the top. I believe that this is one of the missing links that we have in those health disparities. And here's why. Here is the counterfactual. Here is a child who's at the top experiencing good health, a lot of support from the society, the community, caregivers. That child is born up here. Here's a counterfactual child, born down here with a lot of toxic stress. Here's caregivers, community, and society. This child here has two paths. It can go over here, where there's no improvement. That child, literally, in a couple of decades, becomes a new caregiver. And you have this intergenerational transmission of the effects of trauma. The intergenerational transmission of the effects of trauma. This also emphasizes the life course, and I know there's an emphasis here on life course. Some kids survive, and they get better, and they become resilient. So we have these three forces: support, resiliency, and toxic stress, and the life course all happening at the same time. This is an issue around the world. This is happening everywhere. You think of these kids that are raised in war-torn countries, what's happening to their brain neurodevelopment, and that they become at an age where they're making choices, where they may be joining groups that may be extremists. This is a Harvard conceptualization of this. And so what I'm suggesting to you is, if as a community, that we would focus on is, what are all the things that we can do to impact the intergenerational transmission of the effects of toxic stress, and that we would have an important impact on population health. For people who are, especially of African American descent, not only do you have the experience when you're young, but you experience the trauma of racism and discrimination for the rest of your life. Okay? So you have that on top of any insult you may have had as a child. This is what we're dealing with, and unless we begin to address this as a collective community. And the other thing I want to emphasize is, you're never going to have a 0 to 5-year-old here doing a keynote, okay? They are a silent population. They are 100% dependent on adults. They're 100% dependent. They're never going to advocate for themselves. That's one of the reasons why this has become one of my passions, is to really get the idea out there that collectively we have to do something, okay? And so the last thing I want to just leave you with here is the 4 P's of public health: prevent, protect, prepare, and promote. Prevent toxic stress, protect from toxic stress, and prepare by building resiliency skills, and promote healthy, enriching opportunities. So I gave you a big picture view of data science, and what I suggested is to start backwards, understand individual and group decision making, focus on actionable knowledge, really focusing on how do we do some of the prescriptive analytics, how do we do that advising, how do we help nudge decision makers, policy makers, people in the community to make better decisions. And this is where I think human-centered design comes in, is really starting from how people actually experience their life. I went into the concept of our job, ultimately, at the end of the day, is transforming complex social systems. We have to understand complex systems. We have to realize that requires humility. We have to transform our teams, our teams, organizations, and communities in that order. It requires continuous improvement, taking risks, and learning from our failures. And then what I wanted to do is I wanted to focus you on a very specific focus area, which is the health inequities. And the idea here as a population is that the issue of intergenerational transmission of trauma, that this is a population phenomenon that we could all tackle together. And so you can download the slides, and I am done. Thank you so much.